Welcome to the Deep Dive, the show that extracts critical insights from dense research to give you the knowledge you need fast. Today, we're focusing on a really relevant topic for our audience. As part of our What's New in 22Q segment, we are diving into an incredibly important review focused on a specific, powerful medication. It's used when addressing psychotic symptoms related to 22q11 deletion syndrome. As many of you know, 22q11 deletion syndrome involves a whole range of medical and neurodevelopmental issues. But one area that understandably causes significant concern for families is the risk of a psychotic illness. The statistics show about, well, one quarter, 25% of individuals with 22q face a high risk of developing something like schizophrenia. And when that happens, finding an effective treatment is just absolutely crucial.
It really is.
Yeah.
And for those cases where the first few antipsychotic treatments haven't quite worked, what clinicians call treatment-resistant psychosis, the standard approach often involves looking at clozapine. It's a powerful medication, yes, but it comes with pretty strict requirements. Usually it's only considered after symptoms haven't responded well enough to at least 2 previous medications.
Okay, so we're talking about a drug that's already seen as, high stakes, and it's being used in a population, the 22q community, who already have their own specific underlying medical vulnerabilities. That sounds complex.
That's exactly the tension, the thing we need to unpack today. For a long time, we mostly had small studies, case reports, bits and pieces to understand clozapine in this group. But this year, we got a really major synthesis. The review we're looking at today is called Clozapine Use in 22q11.2 Deletion Syndrome, a systematic review of the literature. Okay. It's led by Mark Ainsley-Cohen and his team, and it was published in the Journal of Clinical Psychopharmacology just this year, 2024.
Wow, okay. A systematic review. That sounds like a massive undertaking. So their goal was to pull together all that scattered data.
Exactly. They gathered information from 26 different articles describing 57 individuals with 22q who were treated with clozapine. And this combined data, it lets us get a much clearer, broader picture of 2 key things. First, how effective is clozapine really for these individuals? And second, how tolerable is it? How safe?
Okay, great. So let's unpack that. Maybe start with the good news. What did the review tell us about whether clozapine actually helps with treatment-resistant psychosis in this specific group?
Well, the findings are strongly reaffirming, which is good news. The review clearly shows that individuals with 22q11 deletion syndrome who have this treatment-resistant psychosis can benefit, often greatly, from clozapine therapy. The data, when you pull it all together, it's genuinely encouraging for families facing this really tough challenge. Across the various reports and series they looked at, roughly 65.5% of individuals had what they called a good response. And that number includes people who actually achieved full remission of their symptoms.
Wow, 65.5%. Even for a group that's already resistant to other treatments, that's a really significant number. That's quite hopeful.
It is.
But what about the other, say, 35% who didn't respond as well? Did the review give any clues about why or what might be different for them?
That kind of detail is often harder to pull out from a review looking back at older data like this. But the main message is really that for a big majority, it seems to work. For example, this review mentioned another study by Butcher and colleagues. They found 65% of their group were much improved, and another 20% were very much improved. So when it works, it seems to work quite powerfully.
Okay. Now let's talk about dosing, because you mentioned this population has specific vulnerabilities, and the review noted something interesting about the doses used, right? They seemed quite low.
Yes, they did. That was a key observation. The review noted that the average or median maximum daily dose reported was often relatively low compared to what's typical in general schizophrenia populations. For instance, in one group of cases they looked at, the mean maximum daily dose was only around 202 milligrams.
202 milligram, that is quite low compared to typical doses I've heard about. So what does that imply? Does it maybe suggest that people with 22q might be, I don't know, metabolically more sensitive to this drug?
That's precisely the hypothesis, yes. It strongly suggests they might be more sensitive, meaning a lower dose could be enough to get the needed therapeutic effect. But, and this is the really crucial connection, even with these lower average doses, the review also highlighted that the 22q11 population seemed to experience a higher rate of serious side effects compared to the general population taking clozapine.
Wait, hang on. So lower doses work, which sounds good.
Right.
But they still get more serious side effects. That heightened vulnerability, that seems like the absolute key takeaway here, doesn't it?
Absolutely. It underlines the need for extreme vigilance. And the main serious risk that came up again and again in the review, by far, was seizures. This is just a critical point that families really need to be aware of and discuss.
Okay, let's dig into that. Why? Why is the seizure risk so much higher in this specific group?
Well, when you look at the factors, it's sort of a perfect storm, or a double whammy, really. First, we know that 22q11 deletion syndrome itself carries an increased baseline risk for seizures, just inherently. Second, clozapine, the drug itself, is known pharmacologically to lower the seizure threshold for anyone taking it. So you combine those two risk factors, the underlying condition and the effect of the drug, and the risk is significantly multiplied. And the studies reviewed confirmed this. Seizures were the most commonly reported serious adverse effect they found overall.
Okay, seizures are the #1 concern. What other serious side effects did the Kalina review mention we need to be aware of?
Well, the other major area is blood monitoring, which is always important with clozapine. It requires frequent blood tests because it can affect white blood cell counts. The review tracked reports of things like leukopenia and neutropenia. That means a drop in infection-fighting cells. Sometimes they fall into what they call the yellow zone or red zone, which means the dose has to be stopped or reduced right away. And in rare cases, it can even cause something called a granulocytosis, which is a severe drop.
But those are generally caught by the standard monitoring, right?
Usually, yes. That's why the monitoring is so strict and mandatory. But there were also a few reports of myocarditis noted in the review. That's inflammation of the heart muscle. It's rare, but very serious, and needs immediate medical attention because it can be life-threatening.
Okay, this is definitely heavy information, but it's so important. Let's try to translate this science into practical steps. For the families and caregivers listening right now, what are the immediate, actionable things they should be discussing with their clinicians before even thinking about starting clozapine, knowing these risks are higher?
Okay, probably the single most critical practical step that this review highlighted relates to screening before starting. Specifically, checking calcium levels. We know that hypocalcemia, meaning low calcium levels in the blood, is pretty common in 22q11 deletion syndrome. What maybe isn't as widely known is that low calcium itself is strongly linked to triggering seizures. It's a direct risk factor.
Wait a minute, so this really crucial step, checking and fixing low calcium, was often missed in the older reports. That seems like a huge finding.
It really is. The review strongly emphasized that hypocalcemia must be screened for, and if it's found, it must be corrected before clozapine is even prescribed. It seems this vital step might have been overlooked in many of those earlier case reports, potentially contributing to some of those seizure incidents. So, number one, correct the calcium first. That's foundational.
That is incredibly practical. Screen and correct calcium first. Got it. But okay, even if the calcium is normal, the underlying risk from 22q and from clozapine itself is still there. So what about that seizure risk? Can anything be done proactively, like preventatively?
Yes, exactly. The idea of prophylaxis, or prevention, is really key here. Because of that known high baseline risk for seizures in 22q, combined with clozapine lowering the threshold, the review suggests something important. It suggests that using an anticonvulsant medication preventatively, something like valproate or Dalvalproex, should be seriously considered right from the start of clozapine therapy. Think of it like adding a protective shield against that increased seizure risk.
Okay, so maybe starting an anti-seizure med at the same time. But what if, despite that, a seizure does happen? Does that automatically mean stopping the clozapine, especially if it was finally helping? Not necessarily, and this was another sort of encouraging finding from the review. It showed a surprisingly high success rate in managing this problem if it occurs. Looking at the combined data, 7 out of 8 individuals who did have a seizure were actually able to successfully stay on clozapine or restart it after a pause. Usually this was managed by doing things like reducing the clozapine dose or adding an anticonvulsant if one wasn't already on board, or increasing its dose, or sometimes both. So it shows that while seizures are serious and need immediate attention, they don't automatically mean the end of the road for this potentially very effective treatment.
That's really important for families to hear. Yeah. And beyond those preventative steps, there's also crucial advice about ongoing monitoring. Checking the clozapine blood levels themselves is important, especially if the person is taking other medications at the same time, what we call polypharmacy. The concentration of clozapine in the blood needs careful watching because other common drugs, like certain antidepressants or even other anticonvulsants, can sometimes unpredictably raise or lower the clozapine level, and that directly affects the risk of seizures and other side effects. It sounds like the entire medication picture needs really meticulous ongoing management. That's a big commitment for the treatment team and the family involved. It absolutely is. And we need to add one more crucial warning that the review brought up about combining therapies. While valproate is often the go-to anticonvulsant, used for seizure prevention with clozapine. There appears to be an increased risk of myocarditis, that heart muscle inflammation we talked about when valproate and clozapine are used together. So this combination requires extra caution. Even closer monitoring of the heart and those white blood cell counts by the medical team is needed. It doesn't mean you can't use them together, but it means you have to be hypervigilant if you do.
Okay, wow. This systematic review really seems to have done a fantastic job clarifying the whole risk-benefit picture for families and doctors. It confirms clozapine can be highly effective for treatment-resistant psychosis in 22q. That's the potential benefit. But, and it's a big but, using it demands exceptional vigilance about those increased risks, especially seizures, and really sticking to that pre-screening for low calcium.
Exactly. And what's fascinating, I think, is how these findings might shift the clinical thinking. We now have better evidence that lower doses can work effectively. We know exactly which pre-existing issues, like low calcium, must be addressed first. It helps change the conversation from, oh, is this drug just too dangerous for someone with 22q, to something more like, okay, we know the risks are higher here, so how do we proactively manage those specific risks to safely harness the drug's known effectiveness?
This deep dive is brought to you by 22q11 Europe, the European Association supporting families living with 22q11 deletion syndrome. So, I guess the really provocative thought this leaves us with is this. Could the strategy of hypervigilance, meticulously checking calcium, proactively using those lower doses, maybe considering preventative anticonvulsants right away, could that actually transform clozapine? Could it shift it from being seen mainly as a high-risk, last-resort drug into a more tailored, manageable, and highly effective strategy specifically for treatment-resistant psychosis in the 22q population? That's definitely something for you to think about, perhaps explore further with your medical team. We really hope this analysis of the 2024 systematic review by Colline and colleagues gives you clearer information and maybe some specific points to discuss with your doctors. Thank you for listening to the deep dive in our segment, What's New in 22q, produced by Dr. Stefan Elias for 22q11 Europe. Take care, and we'll talk to you soon.